Hello, everybody. So I thought I'd start, first of all, we've talked about ICBs and ICSs. Great. I thought, what is that? So I'd start off talking about what the Dorset system is. So the Dorset system really consists of an integrated care system. You can see here illustrative who are the partners that we work with. Predominantly, it's not just about health. The key thing, those partners include other key players, local authorities, police, fire service, the community. And the ICB that you heard about, the Integrated Care Board, it's a statutory thing that came alive last year, and we were established with our plans and stuff in July of 2023. So what we're about, System Partners about people and communities. And that's really why I'm here today, because it's about us working together collaboratively on ideas and things that make a difference. And who is those partners? So the ambulance service, the Integrated Care Board, that's myself and the team, in effect, the headquarters of the health system. The acute providers, both Dorset County and University Hospital Dorset, and our community mental health provider, Dorset Healthcare University. But we also have in our partnership the two local authorities, Public Health Dorset, and the voluntary sector via the Voluntary Assembly, which is a really important component, and primary care through the GP Alliance. Oh, how about that? Right, I was speaking to the mic. I don't use my mic usually because I'm quite loud, apparently. So, 4 core purposes: improve outcomes in population health, tackle inequalities, enhance productivity and value, and you heard that picked up earlier on about that value, and help deliver the broader social and economic development. And that's really important because people forget that actually from a health perspective, 80% of the difference, the determinants of health, is outside of the health system. And we do that through the principles of the citizen, place by default, collaboration, transparency, and high performing. So this is the thing that you can see on the internet, the outward facing, what we call the joint forward plan. Every ICB has a joint forward plan. We focus on the strategy. We focus on these things on the right, which is we have decided a system, that's the local authorities, our community partners, that we will focus on these big things, although we will do all the other things as well. But these are improve the lives of 100,000 people impacted by poor health, prevent 55,000 children from becoming overweight in 2040. And of those that may have read The Guardian only last week, we talked about the obesity and the crisis and how that, if we can tackle that, we can change lives. Reduce the gap in healthy life expectancy from 19 to 15 years by 2043. That's moving the areas of deprivation, levelling up to make sure everybody has access, the inequalities. We'll increase the percentage of older people living well and independently in Dorset. And Dorset, as you know, is an outlier. We have a significant higher population that are ageing, and they really need to focus on that and aging well. But also what we need to do is focus that as people move from late working age into older age, that actually that is a nice transition. So all those things really work well. And we will add 100,000 life years to the people of Dorset by 2033. It's ambitious. Ultimately, these 5 pillars are underpinned by digital plan, people plan, but also actually we're already connected about the strategy you talk about. There's a art and creative strategy that needs to link in as well, and how that plays into what we do. And in effect, in simplicity, what we're trying to do is what Samir Gray talks about, moving from a lifespan to a health span. And in effect, that's what we look like at the top, but we want to be those 100,000 healthier life years, that you have less time in ill health, less time in hospitals, and more time in having that quality of life. And I think that touches upon what we started with this morning's conversation about creating that different approach, that actually people need to live healthier lives. We need to prevent them having ill health, and if they fall into ill health, we need to take them out of that space as quickly as possible. And our approach is very simplistic. It's about civic level interventions. It's about service-based interventions for ourselves, community-based interventions, and then where that is within the neighbourhood and in the place. So I thought I'd give you some examples. I was told to entertain. I wasn't told to entertain, but I will try to entertain. Health and art in the NHS Dorset. So the picture on the left is Bastion. It's painted by an artist that was residence when I was there. That's me on the other side. I only have been in the NHS for 3 years, but dominantly my life has been spent in the armed forces as an army medic. And it's something that shaped me about health and art. The picture here of a dressing station is painted by Henry Tonks. For those that know him, who went to the Slade School of Art, Henry Tonks was also a surgeon before he became an artist. Many of the artists, so Stanley Spencer, that's the picture down on the left over there, of a dressing station in Salonika, joined the Royal Medical Corps because they didn't want to fight, they didn't want to take lives, but in the First World War there was a percentage, you had to go and do your thing. So they wanted to go and be part of the movement. So they went to the First World War and they served as stretcher bearers or ambulance drivers. And this is Henry Tonks and Gillies. So Henry Tonks and Gillies worked together on reconstruction. So Gillies was the surgeon that put together and did the first facial reconstruction, the Slade School of Art, doing plaster casts and creating art, because that was the only way you could recreate the faces of the soldiers in the First World War. And then, of course, it's art and music. So Vaughan Williams on the left was an ambulance driver in the First World War. And The Lark Ascending was written from his experiences in 1918, or what he experienced in England, but also what he saw from what he experienced as a bearer on the front line. And a hero of mine is literature. Spike Milligan. Spike Milligan's third book here, Monty, His Part in My Victory. His books inspired me when I was young, but his third book is about his story about suffering from post-traumatic disorder, having been hit by inbound artillery while serving the Battle of Monte Cassino. But actually, Spike Milligan suffered from mental illness and dealing with that for the whole of his life. And he's one of those people that always was open about it when other people weren't open about it. His books, his poetry all set the scene about art and health, and obviously he served in the First World War in the Royal Artillery. So what are we doing in Dorset? So I'm going to give you some practical examples. We started to create outpatient assessment centres and community health villages within the community to take people out of acutes and start to engage nearer to where they live and to understand and help them and see people in a different way. But on our journey, we connected with the Arts University Bournemouth. So we knew that art had a key part to play. So we got the students to come together and they started to create the architectural drawings and lay down and create with the people of Dorset and the clinicians how we would tackle health in a different way. How would we tackle pathways? How would we look about the integration of health and people? And these students together allowed us to create new, different ways of looking at pathways. So here you have an orthopaedic pathway. We started off in a large hall like here. We opened everything out onto the floor. We drew everything out in large as an actual building. And then what we did is when we allowed the art students to work with the patients and the clinicians and the community to understand how you could go from an end-to-end process. And here we have that's turned into an orthopaedic pathway, which starts before anybody arrives in the system, and they work all the way through, and then that includes working with the community. We work with Active and Live Well Dorset. More importantly, what we also did is we had this problem of having new types of working, new facilities, but how do the community find their way around them? And we realised that art was really important for us in that the fact that what we could use is the students to create wayfinding. And the students at the Arts University Bournemouth used a different lens. They really thought about this in the way they did a review of what was going around the world, how they tackled the problem, and realised that some of the art you could put into and colours you put into this facility can actually have an adverse effect on some people's health. So that was really important. We didn't know that. And then they started to create this kind of how do we navigate these people around the facility? And why was that important for us? Because the earlier thing is about creating a pathway where it works really well, that people arrive in a good place, they move around the place, and they actually are navigated. So we have volunteers, Community Action Network, who help us move the patients around, called patient navigators. But actually, also, we need to have a very simplistic way the building's laid out, the colours of it, the signage of it. Who's been to a hospital where they always seem to put signs up but never take them down, and you always get about halfway through, and they want that vital sign, you were looking for that department's gone. Now, how long do people spend waiting to get to their appointment, just navigating around the hospital? You get there probably an hour early, you park your car, you may spend 20, 25 minutes trying to navigate, finding your way around. We wanted to overcome that, and the students did that for us. And so they then created this proposal where we would support the process of encouraging people to help, improve, and ensuring, supporting, and empowering. And what they did is they created a character called Parva. And Parva is to create a person who it's Sanskrit, which means water, linking to pool, where the site was, to understand how that linked to the community. But more importantly, it was also about the Native American tongue, that Parva represents the guardian of health. So this was their idea. This was somebody that would empower. This is about somebody's journey of life. And you can see what they created on the left-hand side, this journey from ill health to wellness. And they did this, and then we applied the designs to the building, and it was, and we didn't use any external consultants. We used the talent of the students themselves to create this product. But we went on from there. So we now created research buses and community buses to go out to see the health. And we thought, how do we then connect the students? The students came up with the designs on the bus you see here. And so now what we've done is we've created this new project with them that they've then gone out, they looked at other buses around the world. And this is really important because this is community buses are reaching out to certain communities that would normally work in research or work with us. So the homeless, the travelling community. So you'll notice that the bus has no NHS branding, has no research or university branding. It's purely about creating colours that engage. And these buses are now being delivered and are available, and they're now starting to go out into the community to deliver both care and research. We also then engage them to design buildings. I say, okay, let's go a bit further. We're creating community hubs in Dorset. We've got 2 that have now been created as part of a project. And one of them is working with the Lantern down in Weymouth, and the other one is just been opened in Poole this morning. And they did the design, and they worked out about how people would engage, how would they come into the building. And we also wanted to create a sense of when people come into somewhere for a community hub, they want to feel like they're $1 million. They want to feel that they are valued. You know, sometimes you go into community space and it looks like it's been, you know, it's not had the investment. There are great people working there, but it just doesn't look right. Do you feel wonderful when you walk in it? And the students decided they want to make this feel like it was high end, that you as an individual were valued. So they created designs, they created the zoning, they worked how the building would work with the community and different types of people with different needs. And then we applied to Dorchester. So we've now applied the same thing with Dorchester and the Outpatient Assessment Centre that you may have seen or heard about, which opens next month, which is in the converted council offices. This is the size of the building. Once again, what have we learned about navigating? Well, we worked with the students, and the students came up with these amazing designs of creating what they'd gone out, and they did focus groups with the people of Dorset. What did matter to the people of Dorset? What did they identify with? Landmarks, colours, and they've then incorporated into the design of the building so that people can then find their way around by landmarks rather than signage. And that works really well. And then in the technical side here, this is how we've applied it to different parts of the building. So I think I'm about 5 minutes early, which is great, because I normally overrun. It really is about not just this. We've now created an undergraduate course with the University of Art and Design, because what we realise actually is that we also need to create economic growth. You saw earlier about connecting the community. So working with our local universities and working with students to say, look, actually, we need to know about how you incorporate health and design from the outset. Often, art and design is incorporated as a part of oh, by the way, we need to paint the walls. It's not about that. It's about really, from the very outset, designing with the community, designing with the architects and the builders and the clinicians to make sure that that building is living and part of the community, and it actually connects with the community through art and design or poetry, whatever we want to use. So you've seen in many hospitals that we've put art into hospitals, which is amazing. Well, what would it be like if you started with art as the start point and then built the hospital? And then you get a completely different experience. And how would that feel when you turn up into that hospital, that suddenly it feels like it's connected to the outside world, it's connected to the things that you value, and suddenly it becomes less clinical and more. And then your experience, and we've talked about, people get better because they feel better, because life is making them better through art, design, poetry, whatever it is. So I hope that this journey with us in your strategy will work with not just NHS, but local authority, our communities, police, fire, whoever, to create that kind of partnership and collaboration, which is what we're about. So I'll thank you very much indeed.